Hello and welcome. My name is Janelle Mirzai. This webinar is presented on behalf of the UCSB Healthcare Facilitator Program. In this webinar, we will be covering the transition to UC retiree health insurance. This webinar is geared towards UCSB faculty, staff, and academic employees who are in the process of retiring or considering retirement in the next 5 years. Here's a brief look at the chapters I will be covering in this webinar. This presentation is intended for communication purposes only. It is not a guarantee of benefits. Details about the UC policies and health plans are available on UCNet. Let's talk about the future of retiree health. The University of California is committed to ongoing health benefits for retirees. However, it is not a guarantee benefits. That means the plan designs can change, and that means your share of costs may increase year to year. Understanding where you need to go and what you need to do will help you feel better equipped through your retirement process. The Retirement Administration Service, RASC, is the administrator and system of record for UC retiree health updates and changes. RASC will remain your primary point of contact during your transition to retirement and after you retire. The best way to research, update information, or contact RASC would be through your UC Raise account. If you have not yet set up your UC Raise account, we strongly encourage you to do so. As of January 2024, RASC now offers retirement counseling and advisory services. It provides a dedicated team of accredited financial professionals and personalized retirement counseling. We strongly encourage you to make an appointment to explore your options and determine what works best for you. Let's take a look at eligibility. Here are some basic eligibility requirements when you retire. In order to be eligible for UC retiree health insurance, you must be enrolled or eligible to be enrolled in a UC coverage at retirement. You must elect a monthly retirement income, have 10 or more years of UCRP service credit for more medical and dental, elect to continue coverage or suspend at the time of retirement. If you select lump sum cash out, you forfeit eligibility for retiree health benefits. All questions regarding your UCRP service credit or eligibility should be directed to RASC or send a message through UC Raise. Graduated eligibility. Currently, UC shares the monthly cost of medical and dental coverage with eligible retirees up to a maximum UC contribution that varies each year depending on your overall costs. Retirees may be eligible to receive from 5% to 100% of UC's maximum contribution to premiums. This is known as graduated eligibility. The amount UC will contribute depends on the date you became eligible for benefits, or your rehired date if you incurred a break in service of more than 120 days, the amount of service credit you have earned, and your age at retirement. Please check our graduated eligibility calculator on the UCSB HR website for an estimation of cost for each health plan. Frequently asked questions. When does retiree insurance start? If you separate in June, July 1 with the July 1 retirement date, UCSB coverage ends July 31st. UC retiree health and Medicare start August 1st. What happens to my family when I enroll in Medicare? Non-Medicare retiree or family, they remain in their current medical plan. For Medicare eligible retiree and family, you enroll into a UC Medicare plan. When may I change plans? Retirement alone is not a qualifying event to change plans. You can change plans during open enrollment or if you move outside of the UC service area. If I suspend, when can I re-enroll? Suspend retiree health insurance if you have other coverage. You may re-enroll during open enrollment or if you have an involuntary loss of coverage. Do Delta Dental and Vision continue? Yes, Delta Dental continues with UC contribution. Retiree Vision with VSP is voluntary. You pay your premiums directly to VSP. What is the CMS L56 form? The main reason for this form is to show proof of employer coverage to avoid enrollment penalty to those aged 65 or older when you retire. For UC employees or their spouses who are 65 or older and retiring, you will be given a special enrollment period at the time of retirement to enroll in Medicare Part B with Social Security without penalty. To be eligible for special enrollment period, you must demonstrate that you had group health plan coverage through your employer or spouse's current employer. The HR department or benefit office at locations can assist with the completion of the Section B of the CMS L56 form. Myself or at the front desk here in HR, we can assist with filling out the employer piece. Let's take a look at the non-Medicare plan options. Not Medicare eligible. If you are not Medicare eligible when you retire, you will remain in your current plan. If you're a retiree and covered by a UC Medicare plan, UC will send you a Medicare information packet with enrollment instructions 3 months before you turn 65. Please check UCNet to view your retiree 2024 monthly cost. One of the most common questions received at retirement is, what are my medical plan options? Let's start with the non-Medicare retirees and their family members. If you reside in California or California service area, you will remain in your current employee plan. UC Blue and Gold, Kaiser, UC Care, Core, or Health Savings Plan. One thing to keep in mind is the UC Health Savings Plan is not available for new enrollments in the retirement, so you must continue this plan from employment to remain eligible. UC Care, PPO, Core, or Health Savings Plans are plan options for non-Medicare retirees and their family members who move or plan to move outside of California but remain in the United States. Whereas if you're planning on moving overseas, then UC Care, PPO, and Core are your plan options. For Medicare, our plan options, this is our Medicare plan options, which I will review and discuss more later in detail. Delta Dental PPO and Delta USA coverage remains the same. This VSP plan is optional. You may pay full premium to VSP. As some of you may know, our Medicare plans do provide yearly optometry and vision screenings, but not glasses or contacts. So if you need contacts or glasses, I suggest VSP coverage. I also wanted to share that UCLA Health now has 3 clinics open in Santa Barbara. If you're interested in seeking care at UCLA Health, these clinics are accepting new patients, and the accepted insurance are UC Medicare PPO, UC Medicare Choice, UC High Option, UC Care PPO, UC Health Savings Plan, and Core PPO. Before I go into detail about the Medicare plans, for those of you who are not Medicare eligible, you can hop off this presentation as we'll be discussing in more detail the Medicare plan options. Each UC medical plan has a Medicare version. You can see on the left-hand side the non-Medicare plans, which are UC Blue and Gold, Kaiser, UC Care, Core, and Health Savings Plan. Each of these plans have a partner plan. When you retire and become Medicare eligible, you will transition into the UC Medicare plan. That means if you're currently in the UC Blue and Gold HMO plan, you automatically transition into UC Medicare Choice plan. Kaiser HMO, you automatically transition to the Kaiser Senior Advantage, and for the Anthem PPO plans, you will automatically transition into the UC Medicare PPO plan. When a family has both Medicare and non-Medicare members, then the non-Medicare members will remain in the current non-Medicare plan, whereas the Medicare eligible family members will transition into the Medicare plans. So if you have some family members who are not yet 65, they will therefore remain in the UC Blue and Gold HMO, while your Medicare eligible family members will transition into the UC Medicare Choice plan. This is what we refer as split families. As a side note, the UC Health Savings Plan is not available to split families. So if you're interested in the Health Savings Plan and you have a family member who is Medicare, who's becoming Medicare eligible, then you would want to transition in UC Care or Core and the Medicare PPO option. Are you moving or thinking about moving after you retire? For the UC Medicare Choice, Kaiser, and Health Option plans, you must live in California or a California service area. If you move outside of California but remain in the U.S., then UC Care Core would be your options. The Health Savings Plan will also be available for retirees who enrolled in this plan prior to their retirement and are not yet Medicare eligible, and the UC Medicare PPO plan is only available for split families. This means when some family members are eligible for Medicare and some aren't. If all your family members are eligible for Medicare and you live outside of California, then you and your family would elect a plan through UC Medicare Coordinator Program administered by VIA Benefits, and we'll take a closer look at this in the next slide. As mentioned in the previous slide, if you're living outside of California but in the United States and all family members are eligible for Medicare, then you and your family will be moved to the UC Medicare Coordinator Program administered by VIA Benefits. For retirees eligible for the maximum UC contribution toward retiree health insurance, you will receive a $3,000 contribution toward a health saving reimbursement account each year. This contribution is subject to graduated eligibility. This means if you're not eligible for the maximum contribution, you will receive a percentage of $3,000 contribution. You then use these funds to purchase an individual Medicare health plan in Part D through VIA Benefits. Any unused HRA funds roll over to the next year. What if I'm thinking about moving outside of the U.S.? What is available to me if I move outside of the U.S.? As many of you know, Medicare is a federal program. Therefore, you do not have international coverage through Medicare. If you plan on moving outside of the U.S., your plan options at retirement would be the UC Care PPO and Core plan. Both of these plans offer international coverage. Now let's take a look at how UC retiree health insurance premiums are calculated. Each year, the UC determines the maximum contribution paid towards retiree medical and dental premiums. Maximum contribution does not mean that UC pays retiree health insurance in full, but that retirees are eligible for the maximum amount UC pays towards retiree health insurance. That said, some retirees are eligible for the maximum UC contribution and others may have graduated eligibility. They receive a percent of the UC contribution amount. If you're eligible for the maximum UC contribution, you can find these rates on UCNet under Retiree Medical Plan Costs 2024. The maximum contribution rate is listed on UCNet and is broken into 4 categories. You'll want to research the category that you and your family belong to determine your premium. For folks with graduated eligibility, RASC will calculate your premium based on your age and the years of service credit. You can find additional information in the Retirement Handbooklet on UCNet, your UC Raise account, or by checking the Retiree Premium Estimator located on the UCSB HR website. Next, let's take a closer look at Medicare and how Medicare and UC plans work together. Medicare is a federal program that provides medical insurance for people 65 or older, people with disabilities, or specific medical conditions. Medicare covers most medical services but does not pay total cost of care, and it serves as the foundation for all UC Medicare plans. I always encourage folks to contact Social Security if they have any questions about eligibility or how to enroll. Applying for Medicare is easy. You apply for Medicare Part A and B, or B if you've already enrolled in Part A. Complete the appropriate UBIN form, an enrollment form to transition you from the non-Medicare plan to a UC Medicare plan, and inform and give your doctor your Medicare card and UC Medicare ID card at your next visit. Let's take a look at the different parts of Medicare. Part A provides partial coverage for hospital stays, skilled nursing, and hospice. Part B provides partial coverage for office visits, labs, and medical equipment. Part D covers prescription drugs. Now, I'm sure you noticed I skipped Part C. Part C is the name used for Medicare Advantage plans. Under a Medicare Advantage plan, you assign your Medicare over to a private insurance provider, and they manage your healthcare needs on behalf of Medicare. Part C Medicare Advantage plans generally combine coverage for Part A, B, and D. Medicare reviews your modified adjusted gross income reported on your IRS tax return from 2 years ago to determine your Medicare premiums. So this year, Medicare will be reviewing your 2022 tax return to determine your 2024 Medicare premiums. There is no monthly premium for enrollment in Part A. The Part B premium for 2023 for most will be $174.70. If you made more than $103,000 as a single person or $206,000 jointly, you pay the standard premium amount and income-related monthly adjustment amount called IRMA, which is an extra charge added to your Part B and D premiums. Medicare and UC premium breakdown. You have separate Medicare and UC premiums. Your Medicare Part D, and if you have higher income Part D premiums, will be deducted directly from your Social Security check. If you're not yet receiving your Social Security benefit, then your Medicare premiums will be billed to you directly in 3-month increments, whereas your UC medical and dental premiums will be deducted monthly from your UC pension check. Since vision is optional, you will pay your premiums directly to VSP. Now let's explore the cost of medical care. Medicare and your UC plan pay most of your medical expenses. They work together. Each of the plans may have different benefit, costs, medical providers, service area, behavioral health providers, and enrollment and disenrollment process. Please take the time and review your plan carefully. UC offers 2 Medicare Advantage plans. UC Medicare Choice PPO Advantage and Kaiser Senior Advantage HMO Advantage. For UC Medicare Choice, you assign your Medicare to the insurance plan. Provider bills insurance directly. Referrals are not required. For the Kaiser Senior Advantage plan, you assign your Medicare to the insurance plan. Provider bills the insurance directly, cannot use Medicare outside of the plan, and PCP and referrals are required. Choice of physician. UC Medicare Choice is a PPO Advantage plan and it's administered by United Healthcare. You do not need to assign a PCP. You do not need referrals for specialists. May use United Healthcare doctors or Medicare doctors who accept Medicare assignment and are willing to bill United Healthcare first. Under the Kaiser Senior Advantage Plan, you must select a primary care physician. It's the same process as an HMO. Your PCP coordinates care. PCP refers to specialists, and specialists limited to the Kaiser Medical Group. Under the UC Medicare Choice and Kaiser Advantage plans, you pay copays for care and you do not have a deductible. That way you know exactly what you're paying for each service and there are no surprises. Here are some examples of the services and the copay amount. In addition to the UC Medicare Choice and Kaiser Senior Advantage plan, the UC offers 3 supplement to Medicare plans: UC Medicare PPO, UC Medico PPO without pharmacy, and UC High Option. Now, the UC Medicare PPO without pharmacy is the exact same plan design as UC Medicare PPO plan, with the exception that it does not include pharmacy. Since these plans are supplements to Medicare, Medicare is the primary insurance, and the UC Medicare PPO and High Option plans are secondary. Under these plans, you have an annual deductible and you will pay the co-insurance after Medicare. Again, under the Medicare supplemental plans, Medicare is your primary and Anthem is your secondary. Therefore, whenever you need to see a doctor, you must visit Medicare providers for Medicare services. You can visit Anthem or non-Anthem providers for additional services. So when you're at the doctor's office, you're going to supply your Medicare card as they are your primary, and Anthem is your secondary. In this hospital example, the Medicare Part A deductible is $1,600. Anthem pays the full Part A deductible for both the Medicare PPO and the high option plan. In this example, the first 20 days of skilled nursing are paid in full by Medicare. Then from the 21st to the 100th day, the rate is $204. For days 21 through 100, Anthem pays 80% under the UC Medicare PPO plan and 100% under the high option plan. If you are traveling outside of the US, there are some things to keep in mind depending on which plan you're enrolled in. If you're in the Kaiser Senior Advantage plan, you will be covered for ER and urgent care services only. For UC Medicare Choice, you'll be covered for emergency, urgent care, and routine care, and you will just have a copay. For UC Medicare PPO, you'll have a $100 annual deductible and 20% of the billed amount for the services. UC High Option, there's a $50 deductible and 20% of the billed amount for the services that you received overseas. Each of the UC retiree health insurance plans offer mental health care and substance abuse treatment. Coverage and provider networks do differ. Behavioral health coverage and providers for non-Medicare plans are the same as the UC employee plans, whereas the behavioral health provider changes once you transition into a UC Medicare plan. Now let's take a look at prescription drug coverage under the UC plans. Medicare Part D. You pay copays for a prescription and some formulary list depending on what plan you're in. ID cards. UC Medicare Choice and Kaiser members. You will have one card both for medical and pharmacy on the same card. Anthem PPO members, you will have two cards, one for medical and one for pharmacy through Navitus. All of the UC Medicare prescription drug plans have drug maximums. So each of the plans have a bundled prescription drug plan with the exception of the UC Medicare PPO plan without pharmacy. Each of these plans have a prescription maximum. That means once you hit the maximum in the plan year, the plan will pay 100% of the cost for the rest of the year. If you're interested in the UC Medicare PPO plan without prescription drug plan, you might be a good fit for retirees with graduated eligibility who may want to consider this plan to help reduce the out-of-pocket cost, or if you have less than a number of years of UCRP service credit. Please keep in mind, Medicare allows only one Part D drug plan. You can enroll in the UC Medicare PPO without pharmacy, but must enroll in a non-UC Part D drug plan. You will then need to provide proof of this coverage to UC in order to avoid penalties. When you enroll in Medicare, it will depend on whether you're still an active working employee, retiring and turning 65, or retired and turning 65. Employees. You may enroll in Part A when first eligible at 65. However, it's not required. If you enroll in Part A, do not enroll in Medicare Part B or D. Spouse enrolled in your UC employee plan does not need to enroll. And you will have a special enrollment period at retirement. Employees special consideration. Here are some special considerations for the health saving plan. Delay enrollment in Medicare A, B, and D until retirement. Please note, if you are drawing a Social Security pension, you will automatically be enrolled in Part A at age 65. You cannot contribute to HSA. Domestic partners. At age 65, consult with Social Security about when to apply for Medicare. You may or may not have a special enrollment period while enrolled in an employee plan. Eligible at retirement. You are eligible for Medicare when you retire. Apply for Medicare Part A and B 2 months before you retire. Enroll online or call Social Security office 2 months before UC employee retires. RASC will send a UC form, which is the UBIN Medicare Enrollment Form. RASC and the Social Security office will advise you on the CMS L56 form. And myself or front desk here at the benefit office in HR, we can assist with filling out these forms. If you become eligible for Medicare after your retirement, then you will want to apply for Medicare Part A and B about 3 months before your 65th birthday. You can apply for Part A and B online on the Social Security website, or you can go to your local Social Security office and apply. UC Medicare forms. These are the names of the forms that you will need to transition from a non-Medicare plan to a Medicare plan. For example, if you turn 65 and are in a UC Blue and Gold plan, you will transition into the Medicare Choice plan. You will complete and submit the UBIN 121 form to the RASC. Once you complete your forms, you will need to submit them through either UC Raise or by fax or mail. Please do not submit your forms online and by max or fail. It will cause delays and additional work for RASC. Please choose only one option of form submission. If you have any questions, you can reach out to me directly and I'm happy to help. Let's review the timeline of events that will occur for those individuals transitioning to Medicare during or after retirement. You may apply for Medicare A and B with Social Security. Social Security confirms enrollment. You send UC form to RASC. RASC and insurance update your plan. Insurance enrolls you into Part D. Insurance sends your new ID cards. You inform providers of your new plan. To those who are thinking about returning to UC after retirement, just some things to consider that returning to work can impact how your medical plan coordinates with Medicare. Therefore, I do encourage you to review the Returning to UC Employment After Retirement fact sheet, which can be found on UCNet. If you aren't interested in coming back to work but are interested in staying connected to the campus, I strongly encourage you to visit the Retiree and Retiree Association. Ellen Pasternak is our Retiree and Retiree coordinator, and she sends out monthly newsletters and details of any upcoming local events. If you're interested in becoming a member or would like to be added to her email list, please contact her directly. Have questions? Please open a service note ticket or contact the RASC by phone or messaging system via UC Raise. I am the healthcare facilitator. My name is Janelle. I can assist with Medicare coordination and UC retiree health insurance questions, and I will be your healthcare facilitator after retirement as well. This concludes transitioning into UC retiree health insurance. Thank you so much for joining us.